Welcome back. I'm joined by Dr. Jim Mason, and he's recently published a research paper in the C2C Journal where we're examining the data of the deaths during the time of COVID and before to see were there excess deaths and what caused these excess deaths now that we see COVID hopefully in our rear window. Dr. Mason, before we went to commercial break, you showed an interesting slide in which we could see that there was definitely a peak, a spike, if you will, of deaths during March and April 2020, right at the beginning of COVID, when that entered our vernacular.
Yes.
Can you explain to me what you think attributed to this spike in deaths? Is that because that's when COVID started and it was wiping us out? Like, what was going on there?
Well, I didn't really look at that in any great detail. I was only trying to find out whether there were excess deaths, and clearly in May and April of that year there were. But there was another paper published in the C2C Journal by Anna Farrow on March 7th of 2022, when she looked at that in some considerable detail. That, of course, was, as you say, right at the start of the pandemic, when the lockdowns had been instituted. And most of those deaths, the vast majority of those deaths, were the elderly, particularly in long-term care homes. And in her article, Ms. Farrow analyzes in great deal, she provides a great deal of evidence to suggest that that was the result of a decision by governments, what she called population triage, so that you, if you like, triage a certain segment of the population and so that another larger, perhaps, segment of the population has a better chance of survival. And what she said, in fact, was there is reason to believe that nursing home residents suffered not just from a broken down system, but from a deliberate effort to protect the healthcare system at the expense of vulnerable long-term care residents.
Oh my.
So that's not my conclusion, no, that's her conclusion, and she's got a whole paper full of evidence to support that. And the data would certainly suggest, but that I looked at, would certainly suggest that that's where the bulk of the deaths occurred.
And I think we all remember, I mean, it seems like so long ago, but you're right, about 3 years ago or so, there was a lot of LTC deaths. We were worried about the elderly, isolate, stay, lock them in. And then when staffing wasn't happening to the level we needed, the government, military was brought in certain Quebec and Ontario LTCs. I remember it was pandemonium. That's how I saw it. But there were a lot of deaths happening. So again, it's not your conclusion, but it seems to correlate.
With the data, yes.
With the data.
And Ms. Farrow presents a whole lot of evidence that suggests that that was a consciously done decision to preserve the health system.
So beyond that spike, if you will, which seems to be accounted for by this Dr. Farrell's or this Ms. Farrell's explanation here, were there any other unusual findings you saw with the data?
Yes. When I got everything finished, I thought I better look around and see whether or not anybody else had done a similar thing and gotten similar results. And I found a paper in the CMAJ, the Canadian Medical Association Journal, written by a Dr. Kimberly McGrail. And in it, she had plotted excess deaths as reported by Statistics Canada. Now, they do a kind of a weekly thing where they predict the excess deaths, that is, the deaths over and above what you would normally expect to see on a weekly basis. And she plotted that along with the COVID deaths that were reported by the various provincial health systems. And that was very, very interesting because in most of the provinces, most of the time, the excess deaths were far in excess of the COVID deaths. Now, you would think if all of the measures had worked out well, it would have, at worst, I should say, the excess deaths should have been the COVID deaths. But in fact, most of the time in most of the provinces, they were much greater.
And I think I have a slide up here that shows a bar graph of demonstrating that.
Yes, that shows over the entire period. She actually plotted from March the 14th to March the 14th, 2020 to October the 23rd, 2021. That bar graph is a aggregation of all of that data, and it shows the mortality rate from COVID and the excess mortality rate together. And you can see for most of the provinces, the excess mortality rate is much greater
Right.
than the COVID mortality rate.
Now, the outliers there, were Quebec, which seemed to have an excess in COVID deaths, but then you had PEI, which seems like it was doing great. People were really sort of living. There was a negative excess deaths.
PEI, I think, from a statistical perspective, it would represent a relatively small sample compared to, say, Quebec and Ontario.
Okay, we're going to talk about Quebec, actually, because I've got to cut to commercial. We'll talk about Quebec in just a moment.
Excellent.